My name is Christina Dunlap, and I'm doing my presentation on DKA, diabetic ketoacidosis. I'm going to go through the patho, the signs and the symptoms, the labs, the treatment and the medication, nursing implications, and patient teaching. So the patho behind DKA is the body doesn't have enough insulin, so glucose can't enter the cells for energy. Because of this, the body begins to break down fat, which produces ketones. These ketones build up in the bloodstream and cause metabolic acidosis. At the same time, high blood glucose causes osmotic diuresis, pulling water and electrolytes out through the urine, leading to dehydration and electrolyte imbalances. The main problem in DKA are hypoglycemia, acidosis, and dehydration. Signs and symptoms. Serious and potentially life-threatening complications of diabetes caused by profound insulin deficiency leading to hyperglycemia, ketosis, and metabolic acidosis. Rapid onset often triggered by illness, infection, missed insulin doses, or new diabetes diagnosis. Early symptoms include polydipsia, which is excessive thirst, polyuria, which is frequent urination, and polyphagia, which is extreme hunger. Progressive dehydration signs include dry mouth, warm, flushed skin, fatigue, weakness. Some GI symptoms is nausea, vomiting, abdominal pain, and it may mimic acute abdominal emergencies. Compensatory respiratory changes include Cosmere respirations, which is rapid deep breathing, and fruity acetone breath order. Neurological manifestations include irritability, difficulty concentrating, confusion, lethargy, loss of consciousness, or coma in severe cases. Labs. Diagnostic criteria includes a plasma glucose of more than 250, arterial blood pH of less than 7.3, and a serum bicarbonate of less than 18. Ketones present in blood and urine, elevated anion gap due to keto acid accumulation. Electrolyte abnormalities. Serum potassium may be normal or elevated initially, but total body potassium is depleted and levels often drop with insulin therapy. Hyponatremia commonly occurs due to osmotic diuresis and fluid shifts. Renal indicators of dehydration include elevated BUN and creatinine from dehydration and decreased renal perfusion. Prompt recognition of these findings is essential to prevent cerebral edema, shock, and death. Treatment. DKA is a critical life-threatening complication of diabetes, especially type 1, identified by hyperglycemia, metabolic acidosis, and ketonemia. Primary treatment goals include correcting the dehydration, reverse ketosis, and restore electrolyte balance. Initial management, we need to do fluid resuscitation with normal saline to treat hypovolemia and improve renal perfusion. When the serum glucose gets under 200, we will adjust IV fluids to include dextrose-containing solutions to prevent hypoglycemia. Insulin therapy, continuous IV infusion of regular insulin to lower blood glucose and suppress ketone production. Electrolyte monitoring and replacement. Potassium must be monitored closely. Insulin drives potassium into the cells, causing hypokalemia. Replace potassium if the serum potassium is less than 5.3 and continue supplementation as needed. Sodium phosphate and bicarbonate may require correction based on labs. Nursing implications. You want to recognize hallmark DKA signs, which include polyuria, polydipsia, fruity breath, nausea, vomiting, abdominal pain, dehydration, autoimmune status, and Kussmaul respirations. Perform frequent monitoring of vital signs and neurostatus, blood glucose, and serum ketones, arterial pH, bicarbonate, electrolytes, especially potassium. You want to be aware of potassium shifts. Admission potassium may be normal or high. Total body potassium depleted. Insulin therapy may cause rapid hypokalemia, which can lead to arrhythmias. Administer ordered treatments, IV for dehydration, continual insulin infusions, electrolyte replacements. You want to monitor for complications such as fluid overload or cerebral edema, especially in pediatric and adolescent patients. You want to assess response to therapy, which include urine output, cap refill, mentation, and resolution of acidosis. Patient teacher, you want to educate on warning signs, hyperglycemia, ketonuria, fruity breath, flu-like symptoms. You want to reinforce the importance of medication adherence, especially during illness or stress. You want to teach sick day rules, which include checking blood glucose every 2 to 4 hours, monitoring ketones regularly, maintaining hydration, continuing insulin even if they're not eating, and knowing when to call a healthcare provider. You want to teach the patient how to adjust insulin doses based on glucose trends. You want to teach the patient how to use ketone strips, and you want the patient to recognize when symptoms require emergency care. And this is my works cited page.